This episode of The Capsule in Conversation is brought to you by Harrogate Springwater. Harrogate is the home of the British Spa and Britain's premium natural source water. Hello everyone, welcome back to The Capsule in Conversation. I'm Natalie Anderson and today I'm joined by one of our NHS angels, vascular nurse specialist, sometimes singer, and one of my oldest friends, Jules Thackray, to talk a year of COVID, how to cope, and calling out for help when you need it. So settle down, turn us up, and get ready to join in with our conversation. Hello all, thank you so much for joining us today. It is so lovely to have you with us. How are you all feeling? I have to say things have been somewhat calmer since the kids went back to school. I can almost see my forehead again without wrinkles. I think we can all agree that it's been an incredibly difficult time for all of us, and as tomorrow marks exactly a year since the UK went into national lockdown, it's been our NHS that have taken the brunt of the pandemic. They have worked relentlessly through the rising levels of coronavirus cases and deaths, putting themselves at risk on a daily basis, a threat my guest today knows all too well about. She's been nursing for nearly 20 years. She's also an absolute legend with the biggest heart and someone I'm very proud to call my friend. Please welcome the gorgeous Jules Thackray. Hi, Jules.
Hi, you've just made me cry.
I'm
very well done.
Because you're amazing.
Oh, no, bless you.
Well, you thanks so much for being with me today. You know, it's an absolute pleasure to have you. And you'll probably go again now. Firstly, on behalf of everyone across our country, thank you for being an incredible human being. You know, without people like you putting themselves out there, God knows where we'd be right now. You are a real life angel.
Oh, bless you, love. I don't think I've had it as hard as some of my colleagues, but yeah, it's definitely been a difficult year for sure. So yeah.
Well, as I said in my introduction, you know, tomorrow marks exactly a year since we went into national lockdown. And in all of your years of nursing, have you seen anything like what we've dealt with in the last year?
No, never. And I think in the beginning, first lockdown was awful. It was really scary. We didn't know what to expect, and you know, we'd never seen anything like this before. And I work as a vascular nurse specialist, so I'm not ward based, but I see people on different wards who need my advice. Our vascular ward is a surgical ward, and suddenly that got changed into a COVID medical ward. So all those staff who were used to looking after surgical patients were now looking after patients with COVID. All the patients I were looking after were all over the hospital because they had to be moved to different wards where we could look after them. So that were really hard on then the nurses on those other wards having to look after a vascular patient who they'd not necessarily looked after before. So I were there to support that. And then the worst thing for me was the complications initially due to COVID for vascular patients were huge, and it were always worst case scenario. So we did have to go on to ICU and see patients with COVID who had really, really drastic vascular complications. So
now, when you say vascular complications, what does that actually mean? Like for somebody like me who's not, you know, not medical, what does that mean?
So vascular basically is your arterial and your venous circulation. So I think initially when we didn't know much about COVID, people who were really poorly in ICU were getting blood clots and things, so it was blocking the circulation. So when you say, you know, the most drastic of vascular injuries is limb amputation, and that was happening quite a lot in the beginning. I've spoken to some of my regional colleagues, and I think it's been, you know, a problem initially, but I've not seen that as much in lockdown 2 and lockdown 3. So I think it was definitely an initial sort of, wow, this could be a complication of really seriously ill patients with COVID. So yeah.
I mean, if we
So
go back to if we can go back to last March, you know, at the time, health officials were warning that the virus was spreading at a rapid
mhm.
rate. Other countries were locking down, but we were quite hesitant. You know, what was your experience of that month? You know, in the hospital, was there whispers on the ward? Were there more people coming in? What was that like?
I think um, it's really weird because we were just expecting it next week, and we were expecting it next week, and he's going to lock us down. It's got to be next week because things are changing. You know what I mean? So I think the people working in the hospital definitely wanted it because you could see how quickly. So at St James's, we've got where there are infectious diseases ward and respiratory wards, and those wards were filling up really quickly, and that's why they had to spill over into LGI wards for patients with COVID and change wards to be COVID wards. And also the intensive care units were full at St James's, they were full at LGI, so then they were changing operating theatre, post anaesthetic care into COVID ICU and things like that, just to prepare for beds, and they got full really quickly. So yeah, it was
I mean, you're based at Leeds General.
hard.
I've got a quote here from the Chief Medical Officer of the Leeds Teaching Hospitals Trust, and she said about the staff and the increase of patients, she said, some are up for the challenge and others are feeling very anxious about the situation, but they're all absolutely committed to delivering care for patients. Now, clearly, she states in that everyone's feeling a bit anxious. You know, yes, we're trying
Yeah.
to rise to the challenge, but this disease is so infectious. You know, how was that again amongst your colleagues?
Well, so regionally, as vascular nurse specialists, we're really close in terms of support, and but we've all trained very differently, and some of them were getting redeployed to wards and be ward nurses, which I could do because I've been a ward nurse. I can do that, but I were fearing that I'm going to get put on ICU. I might be a band 7 nurse specialist, so on paper I look like I'm high up and I can care for patients and do my job really well. But I can't work in ICU because I've never worked there before. Do you know what I mean? I can't look after a patient who's hooked up to all those machines. But my colleague Kate at Huddersfield, she had that experience. So she did get redeployed to ICU. So she was not a vascular nurse specialist throughout the first and second lockdowns. She was an ICU nurse. And her stories are just horrific and so sad, and so different from what you're doing day to day, and but remembering your skills from when you trained and just being able to just pick it back up again and do that sort of nursing. So, and it was hard for me because if I went into ICU to see a vascular patient, on a ward you'd put your mask, you put your visor, you put your pin in your gloves, but when you go into A&E, you have a different type of mask, you have the visors that you put on, you have to wear the surgical gowns, and I'm going into ICU and dealing with some quite horrific wounds as well in that full PPE, and you're sweating and it's warm and it's difficult. And you're emotional anyway because you think, oh God, look how poorly that person is. It's awful. And I were in there for what, an hour. My colleagues who work in ICU, they had to wear that all day. Do you know that were there? It was so hard. I don't even know how people did it and how they still do it. I guess now, as nurses, you get used to things really quickly. You sort of kind of take it on chin. I found it so difficult, and I've struggled with my mental health in the past, particularly anxiety. But there was just one weekend, I think, end of May, beginning of June, and I just bawled my eyes out. I couldn't. I felt bad coming home sometimes, to my family, knowing that you'd been in those places. But then I knew that I was doing everything right when I were in the hospital, so it was all right,
I was going to say, how did you
Yeah.
feel like that? And like, you've got two kids, you've got Jacob and Emmy, and Dave, your husband as well. I mean, how did you feel knowing that you'd been in the hospital, like you say, and it was so infectious, and then going home? I mean, were they scared? Was Emmy scared for you?
Yeah, they were all scared. They were so supportive though. And like, I tried to tell myself, you have not got it worse. There's other people who are working in those situations all day, every day. You're going in there as a visitor, you're staying for an hour, you're doing what you need to do, and then you're leaving it. But it will, you get changed at work, you put your stuff in laundry bag, you come in, you chuck it in washing machine, you go upstairs and you have a shower before you even say, hi family, I'm home. Do you know what I mean? It was just like, and I think I'm more relaxed about that now, and not because I don't think that it's as serious, but we seem to have it. I feel like we know how to deal with it now, so it's different. And if I do get called to a COVID ward to see a patient, I'm no way as frightened as I used to be, because you'd be like, oh my God, what's going to happen? What if I get COVID? But it's not like that, because when you go on that ward, you are protecting yourself and the patient from, the clothing and the PPE that you put on, so you're doing everything right. And touch wood, I've been okay, and my family have been okay.
And so, Jules, like when you went into those wards, and the symptoms have been described as being quite horrific for patients that were really suffering. I mean, what was that like as well, seeing the amount of people suffering in that way?
Well, that, I'm a crier. So, I think when you're a nurse, you harden to certain situations, and I think you harden to death, which is really sad. And it's not as though you don't grieve and you don't feel that pain. It's that you've dealt with it so much that you learn how to put your nurse head on and deal with a really difficult situation. But there were even now, I go in there. I've been on leave this week, but I was in ICU last week, and there's some folk have like an inflatable chamber round, and there's the machines breathing for them, and I can't cope seeing people that poorly, and I guess that's why I've never been an ICU nurse, but honestly, I take my hats off to them. They're amazing.
And for you as well, though, because, as you say, you are still going in to see those patients, and as you said, you are at I've said it in the beginning, you are somebody with the biggest heart, and I imagine seeing families not be together and see people pass on their own must have been truly horrific for you and your colleagues to see people in that situation. Mentally, how did you cope with that? How did you all cope with that?
I was exposed to that side of it really now, because I wasn't there at that time when people were poorly. But I know my friend Kate, and I'll say her name, she's called Kate Humphries, and she's amazing. She's a vascular nurse specialist at Huddersfield. She's literally sat next to people and held their hands as they took the last breath, because they were on their own. And that wasn't just one person a week, that were 3, 4, 5 people a week, and she's a hero and she knows that, but she's just amazing. But yeah, thankfully now I want that sort of nurse during COVID. I still kept doing my job as a specialist, so I might have gone and seen a patient who had to have an amputation, and they might have had an open wound following that, and that's my job to make sure that bit's taken care of. But I was never there at the end of life. But I know the nurses who were, I think when you come into nursing, you don't come in it for money. Nobody ever does. You've got to come in it because you care, and you care about people, and you care about, and always what I always think is that if my dad was there alone, I would not be able to cope with that. And I hope that every other nurse who's working in NHS has that same mentality, that if someone's taking their last breaths, someone needs to be there to hold their hand and be with them. And I know that the only first-hand experience or second-hand experience I have that is what Kate's told me, and how horrific it was. And
so, with Kate, did she receive support? Did she across the board, between you, whichever department you're working in, you'll have those conversations. Did she receive any kind of support, grief support in any sense? Because this is something that worries me, is I genuinely worry about the nursing and, medical staff across the board that have witnessed such horrendous things, and the aftercare for them.
I can't speak for Huddersfield, but I can speak for Leeds, and I've not had to use it myself, but there is a lot of support. So we get weekly bulletins, and there's always there's always emails saying this is a place where you can come and speak if you want to talk to anyone. So there's definitely support out there for sure. Whether people take it or not, I mean, I've struggled with anxiety for years and years and years, and I only had CBT last year following the first lockdown, and I've never wanted to have it. You know, I don't know. I don't know if I didn't believe in it or I didn't think it'd work for me, but yeah, definitely.
But that says something then about the impact of the pandemic, doesn't it? The fact that again, it's taken all that time, you've struggled with it, you've dealt
Yeah,
with it yourself, and the pandemic's come along, and that's been the time that you've had to kind of go and get that help.
yeah,
It just shows the impact across all of our medical staff and, like you say, nursing staff, how truly horrendous it has been for you all in whatever
yeah,
capacity that you work, whether you're hearing those stories on a daily basis, whether you're going into a COVID ward and still facing that threat, you know, even if it's
hmm,
not your normal thing, you're still having to go in there. I mean,
yeah,
you know, someone I wanted to talk to you about, as you touched on him just then, is your dad. I mean, you
mm.
are so close to your dad. Oh my God, I'm going to cry
Yeah,
now.
stop it.
I'm like, literally, how was that? Because I'm sure you've not been able to see him. Like,
It's been, well, first lockdown. So my dad got diagnosed with Parkinson's last year, and he's really fit, as you know, he's 82, but he's always been really fit, really, really fit. And he could walk 3 miles a day easily. So he got Parkinson's, but then he got told he had to shield, so he had to stay in. So the lack of exercise worsened his symptoms, and he just declined before my eyes. Like literally cannot walk out of the house now, and his shaking's really bad. And he's on medication now, so hopefully things will pick up. But no, first lockdown, I did not see him, and he didn't want to see me now, and that was because he was frightened of. He wouldn't even let me bring his shopping. James had to do it because he didn't want me to come. Even though I've been home and I've been showered, he didn't want me to come, and that was really hard because you know, like he's like my bum in left arm, isn't he? So it was like it was really difficult. But then second and third lockdowns, when we knew we were allowed to have carers and caring bubbles and things like that, we sort of shared out what we do for my dad between me, Kelly, and James, and um, he lets me in now after I had my vaccine. All right, I think you can come in now. So yeah, but yeah, still I'm on
good
still
old
day duty.
Barry.
But yeah, he's doing really well. He's better for company because he's so social, my dad, and being in that house, it really changed him definitely. And that were another reason why I had a meltdown. It's because I couldn't see my dad. I felt like he was declining before my eyes, and then Jacob were in his GCSE year and all that, and he wasn't as bothered as I was about him not doing his GCSEs and missing out on prom and missing out on Leeds Fest and all those things that you get to do when you turn 16. I was devastated for him. He wasn't as bothered as I was, you know what I mean? But I felt there were COVID, there were your guilt, there were the guilt of not seeing my dad, and everything just got on top of me to the point of where I couldn't go to work, and then I felt guilty about that because, you know, look what's happening, and I can't be there because I'm having a meltdown. So
But do you know what, Jules? Like, as you say, you can't take these things lightly. You know, you've been dealing with this, your condition for so long, and then it's clearly the pandemic that has, you know, kind of kicked that out there, and
yeah,
you had to search for help. And it's really brilliant that you did, and that you have been open about it, because there'll be so many people out there that are so worried and frightened and nervous about reaching out for help. But you did, and
mm,
you know, I know that it is a battle that you do still face, obviously, and you know you kind of are dealing with it and have help for it. But in those initial stages, you know, how difficult was it for you to kind of put your hand up and go, "Oh, I need some help"?
well, I think it was 2 years before. I'd just literally taken on. I'd set up a new service. I mean, I've been doing this 7 years now, but I'd got overwhelmed. I was doing so much, and I was barely at home. I was just working, 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 and that was my first episode of um, proper anxiety, where I was having anxiety attacks, and I didn't know what. I couldn't even go to the supermarket. I'd have an anxiety attack, and they were really, really bad. So I got put on medication back then, and I've never really been off it. I've reduced it down,
Mm.
and I I think it were on a weekend, and I don't know what. I think I'd probably had an argument with Jacob or something over, mum jobs and kids not doing stuff. It was really minor, but I couldn't breathe. I felt like I was having an heart attack. I was just like, this is not right. And Dave was just like, right, this is a sign that you're not all right and you need to do something about it. So I phoned my doctor and I said, I think I need a sick note. I think I just need some time to sort of get my head together. And because you sort of worked on autopilot, Nat, do you know what I mean? It's like you went into work, you worked, and I never wanted to bring anything home either. So I didn't want to come home and be a grumpy ass because I'd had a shit day. I'd still want to be like, fun time Jules when I got in. And then it was just like, that were really fake, because it was so sad being at work that when you come home, all you wanted to do. So I used to just get in my car, sit outside in multi-story, have a right good ball in my car, just cry my eyes out and go, right, you leave it there now. You've got to go home and be Jules and be all right. So I think I did that too much and didn't realise that it was probably affecting me more than it was, really. And then I went to see my GP and he was absolutely amazing. And he just gave me a sick note. But I was off for about 3 months because I just did not stop having panic attacks or anxiety attacks. I don't know which way to describe it, but it was a feeling of, I think I'm going to have a heart attack. And because I'm a drama queen, I was obviously having an heart attack. It wasn't else. I'm thinking, oh my God, this is awful. But and that happened for weeks and weeks and weeks. So we're approaching my 40th birthday, and Kelly and James had booked a trip to London, and we didn't think we were going to go.
And sister Kelly and James.
Yeah, and we didn't think we were going to go because of the pandemic, and we knew we couldn't see a show, but we said, well, we've got these tickets now, let's just go. And I was like, I can't go to London. I haven't been to Morrison's. Do you know what I mean? I was like, what's going to happen? You know what Kelly's like? She was just like, come on, get your big girl pants on, get them pulled up. I'll do your hair. You're going to London. So, yeah, that were it. And I was like, I couldn't have been with two better people because, they are who they are to me. But it was lovely. And then I sort of slowly got back. I think I went back beginning of September. So my birthday went end of August. And I think I went back second week in September. So...
But that is so brave of you, though, Jules, to kind of be so open and honest, because there'll be so many women that will relate to what you just said there about sitting in the car and just crying their eyes out. I've been there. I've been there, a good few years back, and I've been that person that you're trying to hold it all together for everybody else. You're trying to go, come on, somebody else has got it worse off than you.
Yeah.
You're always thinking of like, other people are dying or this or that, and you're making excuses and you beat yourself up about it and take it all on. And there'll be many, many women that do respond to that and relate to that. And it is important, isn't it, that you kind of just go, it's not a failure to ask for help. It's not you being weak. Actually, asking for help is probably the strongest thing that you can do. Yeah,
and I never used to think that. And we've had these chats before, haven't we, Nat, about sort of being. You feel like when I'm not saying I'm a powerful woman, but what I'm saying is, I'm an experienced nurse. I think I'm quite strong as a person, when you've been through stuff in your life and you learn to sort of be strong. That's what makes it difficult to ask for help, is what I really still worry now about what people think of me. And if, I have a constant desire to be liked, and it's ridiculous. And I'm trying in my old age not to care about that. But you can't change who you are, can you? So if you let someone know that you're not chuffing jazz hands Jules every day of your life, that's really difficult. Do you know what I mean? But then I think I'd put a post on Facebook sort of when I felt all right, because I'd come off all social media because I thought, I don't want to see how happy that person is and what they're doing. And, I don't want to be like that. And like you say, I felt a fraud because I want an ICU nurse. I wasn't dealing with end of life and all that horrible stuff. But I was dealing with some horrible stuff, but not all the time. So I felt like you can't be that upset about working in this pandemic because you haven't had it that hard. Do you know what I mean? So I was like, I can't tell a soul. They're going to think I'm a right weirdo. And then I put this post on Facebook saying, this is what's happened to me. And the amount of comments that came back and said, oh my God, to hear this from you is a really big thing. And you don't think that about yourself, do you? It's like,
No.
you always seem so happy, and you always seem so confident. And to know that you've been through this and it's got you, that really helps. And then you think, all right, I'm not scared to talk about it now, because, it's all right, isn't it? So, yeah.
Kind of quite liberating, but you must never minimize your efforts, Julie, and I know you do this all the time, but yes, okay, you might not have been in ICU, but you were still dealing with the threat of COVID on a
Yeah,
daily basis. That, I felt it going to the shop. I
yeah,
felt nervous going to the shop. You were actually in a hospital or visiting
yeah,
patients. You mustn't minimize that. That is still
yeah,
really difficult job, and I know that you always will go, oh, but they've got it worse than me, they are
yeah,
worse than me, so I should be grateful. Your attitude will always be that. But
yeah,
you've mentioned it a couple of times now, jazz hands Jules, and obviously we met at school at
yeah.
performing arts school, and that's where your kind of performing side really flourished. However, you chose to go into nursing. Now, tell me about that decision. What was it that moved you across? Because I have to tell you all out there, you do not even know how funny Jules is. She's so bloody funny. Literally, a little Julie Walters sat right here.
I know, that was my dream, wasn't it, as well? Do you know what? The only other person I've told in the world is why I left uni is my sister, and she calls me all the names under the sun. So basically, I did at school. I know it sounds really like big-headed, but if you were liked and you were good, you got good parts, didn't you? You didn't really have to try. So I kind of, it were a breeze, really. So I wanted it though, Nat. You had it too, didn't you? So you were like, oh, Natalie's she's the most amazing singer. She's going to get all main parts. Julie's really funny. Stick her on stage. She'll make everybody laugh. And it wasn't hard. It really wasn't hard. And then I did my BTEC in performing arts, and my A-level English just tagged on end. And I did really well. I got distinctions. I did really well in the A-level. I got really good results. Went to Liverpool to study dance and drama. And I got there, and it was a time in my life where I won. Like, I think I'm overweight now. I won't compare to then. I were quite big for my height, and I'm short. I'm 5'0", and I really, really struggled with self-confidence. And I only told my sister last year why I left, and she was like, "You absolute idiot! What did you do?" Because I just didn't think I were skinny enough or pretty enough to make it in the industry. I know. When I'm 40 years old and I think about it now, I think, you absolute dickhead, right? Honestly, I'm like, why did you do that? But I literally were like, I'm never going to make it, because now I have to fight a little bit to get these parts, and I have to be a bit hard. And I'm not like that. I'm a right flake. Do you know what I mean? So I didn't have the sort of pushiness that you need to succeed in that business. And also, I did not have the self-confidence to succeed in that business. I just didn't think that I looked the part. So I left and I didn't do it anymore. And then I came home, and Barry being Barry were like that. Well, you're not sitting on your ass doing all love. You need to sort yourself out what you're going to do. And I was like, well, actually, I want to be a nurse. And he was like, what? Where on earth has that come from? And I'm like, well, none of you would ever listen. You all thought I was just going to be funny and on stage, and none of you cared to listen to what I actually wanted to do. And I probably never mentioned it to a soul. That's why nobody knew. And then I applied for Leeds Uni, and so I got back in like the November, because seriously, that's how long I was there in Liverpool. Got back in November, applied for so when I did nursing, you got a bursary. So there were 2 cohorts a year. So you did April and September. So I applied for the April cohort, got an interview, and they were like, you haven't done any health related A-levels or anything, but we can see you've done really well with your grades. So we're going to give you a chance. And I were over at Moon, and I did really well. And then I qualified in 2003. I've been back to uni 4 times since then. So yeah, and I didn't, academically in my nursing, that were really, really hard. Practically, I used to do really, really well. And I guess there's that bit of confidence that you get from being a performer that makes you able to talk to people. And I think I can still do that. You know, that's never going to leave me. I can talk to anyone, so that's all right.
That's
So
what I love, though. I love the fact, like, when you were a ward nurse and you'd go around and see people and it'd be like the Julie show, like, hiya guys, and then how
completely
many
still
patients
is.
would have loved you? I bet the patients loved you.
Yeah, I was talking about my friend to my friend about this the other day. So when I first qualified, I went to work on care of the elderly because I thought I need to learn all about my medications and my IVs, and there's no better place. They're on a million drugs, they're on a million IVs. It's all going to be all right. My area were pristine because that's what I'm like. Also, they all had their hair done. They were all happy. We'd have a little sing song, and it was really lovely. I loved it. But then, you know, my career, I had Jacob, and things changed, so my career changed and stuff. But you know, I love what I do. I love my job, and I don't even. I think if I won, you know, if I won lottery, I don't think I'd stop doing what I do, for sure. So.
And this is what I was saying again in the intro, Jules. You know, you have such a heart and you want to make people happy. And I do actually think that, you know, that was a lot of why you were performing, is to make people laugh and to make them smile and to make them happy. And what you're doing in nursing is actually really similar in the sense that you look after people, you care for people, you make them smile, you make them better. It's the same kind of thing, really, I suppose. You know, you said you are that kind of person, and your reasons for performing were to bring a smile to people's faces. You know, and as you've just said then, you know, you wouldn't change it. Do you feel like it has been the right path for you, nursing?
Definitely. Like I never thought I'd get to this level. I didn't think I had it in me, do you know what I mean? And I knew I wanted to, so I specialised after I had I went back to uni and I did wound care, postgraduate certificate, and then I went out to work with the team in Leeds community, and they were just amazing. And I already had my vascular head because I'd done that before, but all the things I learned about wounds, and you know, they were just amazing. They've taught me all I know, and I felt so much confidence in myself to do my job that I applied for this job, and I wouldn't have been able to do it without that before, you know what I mean? And then I've done my prescribing, I've done, you know, the first part of my advanced practice, I've done stuff, and I've done well. And I don't know how, sometimes I don't know how I've done well, because Jesus Christ, I've got a BTEC in performing arts, you know what I mean? It's like when I think about where I am now, it makes me laugh, because I'm just like, oh wow, this is really funny. But yeah, and sometimes like when I used to come and watch you, and when you were in Wicked in particular, and I was just like, oh my God, you were so amazing, but I so wanted to be up there as well. Do you know what I mean? But then, you know, maybe I should do some Amdram. Maybe that's what I need in my life.
Do some Amdram, but I don't know if you manage it right now with all the things that you do actually have on. You know, if we just come back to kind of like more current day and what's going on still now, even a year later with coronavirus, you know, now it's all about the vaccine and you know, the rollout. And having seen what you've experienced firsthand, whether it be through your colleagues or whether it be through yourself, you know, there are people out there that are skeptical about the vaccine. What is your advice to them on that?
Well, I don't like putting my pro-vaccine head on. I get nervous about, you know, the backlash, because I worry about my registration. But basically, you know, we're very lucky to have a vaccine. We're very lucky in everything that we've ever had a vaccine for. We are so lucky. My advice would be, have your vaccine, and then we'll get out of this absolute, you know, hideous circumstance. I've had mine. I felt like crap for 2 days. I felt like I could have fallen asleep on a washing line. And, you know, I've actually got my my second vaccine coming up this week. So, you know, my dad's had his. Kel's having hers because she's got asthma, do you know what I mean? And everyone, even my patients who come into clinic now, they said, have you had yours? Do you think I should have it? And I'm like, yeah, go for it.
That's what I mean, is they'll be looking for you and to you as a voice of, you know, being more in the know than many of us that aren't in the health service. You know, there will be people that are worried, and you know, were you worried? What did you worry about it? Because obviously it is still quite a new thing. Did you have any concerns or worries yourself?
No, because I work with really brilliant surgeons, and I talk to them about things, and they research stuff, they read about stuff, and I'm not that bright that I can watch something on TV and go, oh yeah, I'm going to do it for that reason. So, but I've spoke to my colleagues, and I just think it's a no-brainer. And I've, like when you think of all the stuff that we've had in the past, and vaccines have helped us get out of that. And we just got to get out of it, haven't we? It's like we can't go on like this. It's just awful. So we just need to get back to normal. And I would say have your vaccine, no matter which one.
And also, as you just said then, like obviously this last winter, like second wave or whatever it is, has been, again, so horrendous. Do you think now that because we've been more equipped to deal with it, like for example, there was no PPE in the start, and now obviously there is a lot more available. Do you feel like for you guys in the NHS, it's been more manageable, or do you still feel like this second winter wave has been quite horrendous again for a lot of your colleagues?
I think it's been horrendous, but when you think about, we always have a bad time in NHS throughout winter because there's always winter flus, and we always have horrendous bed capacities for that reason. So you sort of prepare for the winter crisis in NHS. Everybody does, and knowing what we needed, having had the first and second lockdowns, I think that's probably helped people deal with it better. And I don't think you'll ever get over how horrid it was in the beginning when it all came out. But I think you can probably think now, actually, we properly know what we're doing. We properly know how to look after these people, and I hope that gives people, some, feeling of positivity, because it does not, I don't know how to explain it really. It's not as though people are like, oh, you learn how to look after people with a certain disease. It becomes like my specialty is vascular surgery. I know how to look after a vascular patient completely. Those nurses who have had to look after COVID patients within a year now know how to look after a COVID patient. Do you know what I mean? And I think that's where it's different. So,
and in terms of, last year, obviously we had Clap for Carers, and everybody came out and clapped and everything. How did that make you feel?
Clapping embarrasses me anyway. I don't know why, but it's one of them things, clap. I'm like, don't clap for me. But literally, all my neighbours will be looking at me and clapping, like it was just for me. And I'd be like, thank you. And I'd be trying to join in. But but it's lovely. It gave people something to look forward to, didn't it? And it were lovely. It were a lovely gesture. People banging on pans and all sorts in Oval. They were loving it. So yeah, it was really nice. So
that just made me laugh though. So literally, you were coming out of the door and like walking
and curtsying.
Everyone's like, yay!
Yeah. Thank you.
Did it make you feel proud though?
Oh yeah, definitely. I still feel proud. I feel proud of all the staff on the ward. I feel proud of my surgical colleagues because they're surgeons and they had to become medics, and they had to look after people with respiratory problems. And obviously they know what they're doing. They're doctors, but that were a huge change for them as well, So yeah, I'm proud of everyone. I think it's when it just became sort of a muck-in sort of time as well. So there were no real hierarchy. It wasn't you weren't going to strut on ward and be like, oh no, I'm a nurse specialist, I can't do that, I'm not doing that. It became like everybody were one, we'll all work together because we're all in this, do you know what I mean? So we've just got to get through it. And I think I'm like that anyway in real life, but even in COVID, I hope that I will, a mucker in her. So,
you are definitely, you're a mucker in her, Jules. You're
a mucker in
her, hon. But what I also wondered as well if, I mean, again, this might not be your area necessarily, but I'm sure you'll have experience of this or like know people that would. So, it's been reported about people being quite violent or mean towards hospital staff, you know, if they're not getting what they want? You know, what's your experience of that as well? Because I find that so infuriating when I think, are you joking? When our nurses and doctors are doing their best to look after friends and family members, and you've got the cheek to be rude or be aggressive, you know, what's your experience of that kind of thing?
Well, I don't think I've had any experience or none of it. I mean, we on our ward, I say our ward, it's not my ward, the vascular ward. You know, we've had people can FaceTime the relatives, they can phone the relatives, we can give them an update. Can you just call my son and let him know? Yeah, of course I can. And people come to the door and bring belongings and things like that, and you can hand them over and just pass on little messages. You know, it seems quite lovely. I'd hate to think that that's happening to people, though. That's awful, isn't it?
Yeah, no, that's
Like,
definitely, that is a thing. Like, especially during COVID, there were lots of
yeah,
people that couldn't obviously see their relatives that were kind of
yeah,
taking it out on the medical
yeah,
staff. And
yeah.
have you ever felt in your job that you weren't appreciated, or even from the government that you weren't appreciated for actually the amazing and level of work that you do?
Oh, you feel, I have some days where I just think, you've been bent over backwards there, and you're still, you're still complaining. But no, not really, because I work with some of my patients are quite vulnerable and have chaotic lifestyles. They might not have anywhere to live, so they can be quite, especially if they go into A&E, they can be buggers and be shouty and be demanding, but they don't do it with me.
I wonder why. Is it because you tell them to shut up?
Shut up. Yeah, no, no, but I think I'm used to sort of quite, I don't want to say the worst of the worst patient, but they've got the worst things going on. And so that might make them angry because they're in pain, or they've got horrific wounds, or, and certainly, like, I work a lot with intravenous drug users, and, when they come into hospital, they might be withdrawing and things like that. So they become aggressive, but because of withdrawal, do you know what I mean? So it's just knowing how to deal with people, isn't it, Nat, really? And, but that's the only experience I've ever had in my career of that sort of behaviour. But it's soon remedied when you just stay aside and you're going to be all right, and I'm here to help you, So I've actually built up nice relationships with them, with those types of patients. So.
And, in terms of, again, just going back to kind of like the last year, it's been incredibly emotional and mentally difficult for you too. And, obviously for your colleagues as well. And so as we come out of this, do you think collectively that, we do have more kind of respect for our NHS? Do you feel that? Do you feel that people are kinder towards you, or maybe have you always felt like that? Because, like I say, you're on the front line dealing with people.
I think it differs. Some people, like, if they're waiting half an hour beyond their appointment time, they can be quite difficult when they come in, or there's some people more understanding. But I think now, definitely there's a better understanding of the NHS and how hard people work. And I know there's all this stuff around nurses' pay rise and things like that, and I know it's really bad of me, but I don't look at that at the minute. Do you know what I mean? It's like, and it's not so what, because that's a really naive thing to say. It's more, let's just get through this, and then, we can fight for a pay rise. Do you know what I mean? But I mean, it's crap, to be fair, isn't it? But I think, I think people.
But you said earlier, you wouldn't change it, and even if you won the lottery, you'd still nurse. And I think that's probably the same for a lot of your colleagues, is it?
Yeah, definitely. Like, you don't come into nursing for the money. And I think the reason why my colleagues are complaining about the rubbish pay rise is because it's the government who make you feel undervalued and underappreciated. It's not the people, it's not the public. You know how much people appreciate what you do because they tell you on a daily basis. Do you know what I mean? You get, thank you, you're an angel, I'm so grateful. And it's when It's when the government comes up with a 1% pay rise for nurses after they've worked their asses off through a pandemic. That's the kick in teeth. Do you know what I mean? That's the underappreciation that you feel. It's not, certainly not from the public. It's the complete opposite. And I guess that's why the public are, some of the public are up in arms about it, because they feel that that's just showing lack of appreciation in it for the work that people have done. But you don't go to work to earn, you know, God, I've been nurse for 20 years, still don't, you know, it's not the greatest salary in the world, do you know what I mean? But who cares? That's what I think. I think it's just the seeing that's what the government think here, 1%, do you know what I mean? That's where it's rubbish.
Totally,
Yeah.
but like as you say, the reward that you get with your patients. I mean, before we just have to round up, Julie, this is another thing. So you tell me you're not strong, right? And yet, when you describe some of the wounds to me that you deal with, I'm like, how do you not? How do you not faint? Like,
Do you know what? I found out, like I'm not squeamish at all, right? I literally, this is just like a really mental story, but I'll tell you because it's funny. But if I see someone with mucky pyjamas on in hospital, it turns my stomach. And I'm like, I'm gonna change your pyjamas just because they're a bit mucky, and I can't have a bit of your breakfast porridge on your top. Can't deal with it. I literally would. It turns my stomach. But I can have a look at a rotting foot and be completely normal and go have my sandwich afterwards.
oh, Julie, I love you so much. You see what I mean? And can I just tell you now what you just said then? There will be so many people out there that genuinely worry about their loved ones being in hospital and not being looked after. And then what you just said, knowing that somebody like you would come along and change their pajamas because they don't want that patient to be dirty or uncomfortable. Honestly, it will be just such a relief to so many people. Just tell me kind of what you hope for after this, and also what your the last 12 months, as you would say, being in the NHS, just in a couple of sentences, just describe what that has been like for you.
It's been scary, but it's been rewarding. I've probably done some of the best nursing of my life over this past year. Do you know what I mean? I've seen in vascular surgery the worst things I've seen in my nursing career, but I've dealt with it and I've come out the other end and I feel all right. Do you know what I mean? And I think that there's hope that this is going to come to an end and we're all going to be able to say, look how ace we were, look what we did. Do you know what I mean? And, you know, hopefully it'll make us stronger. Hopefully it'll make us more accepting of, you know, the NHS and actually what people do there from the bottom to the top.
Oh, Jules, honestly, it's been so wonderful to have you with me today and just to give us an insight into what the last 12 months have been like on the rock face of the pandemic. It's been amazing to have you.
Thanks for having me. I feel so privileged. As if you interviewed Shirley Ballas and Jules Thackray.
Listen, equally as wonderful as each other. I just wanted to say as well, we are so grateful to you and all of your wonderful colleagues at the NHS for your tireless hard work and dedication, and we really hope that the last year has proved how incredibly necessary our NHS is and how privileged we are to have you all in the first place. We are hopeful that Ascot Races will be open again this year, and so our lovely sponsors, Harrogate Springwater, would like to offer you and a friend tickets to a race day meeting as their guest, as a thank you for being an absolutely wonderful human being.
Thank you so much.
So yeah, that'll be coming to
you. I'll have to learn how to look nice again.
Yeah, right, you will not believe what I've just put here. I'm so proud to call you my friend, and you know what she's going to say to me next? What am I going to wear? So, well, if you'd like more well-being and fashion and beauty, then you can always visit the website, Julie.
Oh, yes, loving that little plug at us.
www.thecapsule.co.uk, where you can also catch up with our previous podcast episodes by visiting the In Conversation page and subscribing to any of our podcast channels and YouTube. Do leave us your rates and reviews, as we love hearing your feedback. It's been amazing to see your lovely comments on this series, so thank you. If you're a social butterfly, you can also catch us at Instagram and Facebook at Official Capsule. I will be back next week with another very special guest, so all that's left for us to say today is goodbye. So it's goodbye from Jules.
Bye.
And goodbye from me. This episode of The Capsule in Conversation was brought to you by Harrogate Spring Water. Bottled at source, Harrogate Spring offers a pure, refreshing taste with a delicate blend of naturally occurring minerals and electrolytes, perfect for healthy hydration.